So diagrams. This one might come, so you need to know it. So you need to know that this is the body of the vertebrae. Then we've got what we call the foramen. But what type of foramen is this? Because you need to be very specific. If is it called the transverse foramen, or maybe it has the other names. So number 2, you go and check. It's called the vertebral foramen. Why is it called vertebral foramen? Because it is in the vertebra itself. So it's called vertebral foramen. This side is called the pedicle. This is what we talked about yesterday. So we said the spinal bifida is caused by the failure of fusion of the pedicles. Pedices, pedicle. So you've got the pedicle. This is called the pedicle. And then you have is that called the pedicle? Yeah. And then you've got the lamina number 5. 6 is called the spinous process. 3 is called the transverse process. So the answers are there in the. You can check the answers there. They are there. So this one can come. This one can come. You need to know it. So yeah, that's it there. This one can come. Go through it and know it properly. Maybe if that one cannot come, they can bring this one. This vertebrae. Which one is that? C1. Cervical vertebrae number 1. So this one has got what you call transverse foramen, which is there, and it has the vertebral column, the body, this part, and then it has what you call the spinal process, which is more like anyway. Since there are answers there, it's quite easy for people to just go through them. The dens, these things. You need to know this, the superior something, the foramen. So go through these. But I want you to focus on this one. Where is it? This one is one that came in our paper. I think you people have seen it. So I've got the head. Should be the neck. I don't know. 3 has its own name. Superior you call inferior groove of the vertebra, costal cartilage, typical liver. So this one came. That was a tubercle, the one that I missed. This is the rib number 1. So Madam Toera was asking the differences between the rib number 1 and rib number 2. I mean number 3 and number 2. So Mona mentioned something like there is what we call the true typical ones and the atypical ones. So the typical ones, Mona, what did you say about the atypical ones and typical ones? So page 90, this one, page 90, this one which has got the scan, the tubercles or the attachment of muscles. This one you need to know it very well. This one, this time around, they can bring this one. Since that one was brought, so they can bring this one, which they know that you people will struggle to master. So page 90, this one you need to know it. Please master it. Especially if it is Dr. Mdare who is going to prepare the paper. They can't bring the sternum, unfortunately. Maybe they can bring it. They can bring it, maybe, but I don't know. But you need to know it as well. I want you to know that you have got other things that you need to go through tonight. This one cannot come. Definitely, it cannot come. This one will come. So this one will come, and I can try to label some things. This is the mediastinum. So number 10 is the heart. Number 10 is the heart. Number 10 is the heart. Number what's this? So you have got the muscles. Starting from number 1, it's called the external oblique muscle. Number 1 is called the external oblique muscle because it is external there. From there, number 2, you've got the next layer, which is called the internal oblique muscle. From the internal oblique muscle, you've got the next one, which is called transverse abdominis, which is number 3. Okay. So that one you need to know it. Sorry, not transverse abdominis. So you've got external intercostal muscles. These are intercostal muscles. Why are we saying they're intercostal muscles? Because they're between the ribs. So number 1 is external intercostal muscle. Number 2 is internal intercostal muscle. Number 3 is innermost intercostal muscle. Number 3. Number 4, I think you're able to see how number 4 is looking. You remember this is the aorta. So it comes from there. Boom. This is called the posterior vertebral arteries. Posterior is called, this one is posterior because this thing you are seeing there is a vertebrae. So this is posterior vertebral artery. It moves. I think it anastomoses. with if it doesn't, I don't know, but it goes that side. Number 5, it should be the anterior intercostal artery. Anterior intercostal artery. Number 6, these are internal thoracic artery. If you're able to see them, internal thoracic artery, but you need to be specific. This is called left intercostal. No, left internal thoracic artery, not intercostal, but internal thoracic artery. So this is called internal thoracic artery, but you need to be specific. This is called left internal thoracic artery. Number 10 is the mediastinum, where the heart is. Mediastinum, number 10. These are lungs. You've got the right lung on the 8. You've got the left lung on the other side. So again, I'm saying this one will come whether you like it or not, and then it will be black, so you won't be able to see how you are looking. You are seeing it now, so you just have to sort it and know it. Okay, this is how it looks. This is the external intercostal muscle, internal intercostal muscle, innermost intercostal muscle. From there, I've got number 7, which is number 4, which is the posterior intercostal artery. Number 5, which is called anterior intercostal artery. Number 6, which is called internal thoracic artery. And then number 7 is the same thing. Where is number 7? So number 7 is the nerve. It's called the intercostal nerve. Number 7 is an intercostal nerve. 7. Okay. Number 8 is the right lung. Number 9 is left lung. Number 10 is the mediastinum. This one will come 1 up to 10, whether you like it or not. Number question 41 will come. That one, it will come. The answers are there, so go through it. I don't want to hear that. No, this one was this. No, we didn't do this one. Even this one will come if you are going. So I'm not scaring you. I want people to understand. So 108, this page, go through it properly. You need to master all those structures because we've been doing them in the DR. Everything okay? So there's someone who was Madam Sharon, mute your mic. Okay. So that lung, you need to know them very well. Especially that you did them in the DR. This is what I was talking about, Madam Sharon. You've seen. We saw this question somewhere. So we saw this question somewhere about the heart on the other page. So number 1 is the arch of the aorta. Number 2, we need to know that we've got pulmonary arteries, but this one is going to the right of your hand. So this is called the left pulmonary artery, number 2. Number 3, these are pulmonary veins, left pulmonary veins, number 3. Number 4, what's this? So this is it should be oblique pericardial sinus. We did this in the DR. Yeah, it's oblique because it is more on the angle. We've got 2. There's what we call oblique and transverse. Transverse is number 10. Yes, transverse is number 10. Sinus. Transverse sinus is number 10. While number 4 is oblique sinus. Okay. From there, after 4, we have got number 5. Number 5 is the pericardium. 5 is the pericardium. 6 is the descending aorta. You know that you've got the ascending, it descends. It's on that you are seeing that side. So 6 is the descending aorta. But which one specifically? Because descending aorta is named in according to where it is. So if it is in the thoracic, we call it thoracic aorta. So you can say thoracic aorta number 6. Number 7 is definitely the inferior vena cava. 7 is the inferior vena cava. 12 is the superior vena cava. Number 11 is the ascending aorta. 11 is the ascending aorta. Okay. Number 9 is the pulmonary artery, but it's a branch, right pulmonary artery. That one, number 9. 8, these are pulmonary veins, but the right ones. Because we said the pulmonary veins are 4, we've got the 2 on the left and 2 on the right. This is the oblique sinus. The one that is transverse is number 10. So this artery, again, this artery will come, whether you like it or not. The artery will come. Okay. So you've done the artery. You just make sure to go through the whole diagrams of the artery. As long as you did them, they can bring them. This one is more like it's been put in the posterior aspect manner, and you need to know that. So the answers are there, still you can go through them. These are veins, and these are okay. These are coronary arteries. These are coronary arteries, and these ones are very difficult to identify. So if they want to make you fail, you, they will just bring this one, and then you'll see what to do. So just make sure to go through the whole diagrams, because you can get the marks from there. The veins. This one can come. This one can come. So you've got number one, which is the trachea. Number one is the trachea, and we said the trachea is in front of what? The esophagus. So the esophagus is behind there. The esophagus is behind. So number two is the esophagus. Okay. Number three, we know that this is called the left common carotid. Number three. Number four is left subclavian artery. Is it? Yes. So number four is, sorry, number three is left common carotid, and then the left common carotid is accompanied by what you call internal jugular vein, which is number four, because they move together, and it's bigger, it's larger than the artery itself. So the internal left common carotid artery is accompanied by this one, which is called number four, which is called the internal jugular vein. And then number five is left subclavian artery, definitely. Number six, if you're able to see it properly, number six, what is six? So six is left subclavian. So there's a vein and artery. So the veins are larger than the arteries. So number six is the left subclavian vein. So make sure to see that one properly. The veins are smaller, and they've got the narrow lumen, but they've got the thick lumen. Should be thick lumen, yeah, something like that. That's how you differentiate them. So when we talk about number seven, I don't know if you can see it, but it is called number seven. It starts from there. Seven is the brachiocephalic vein, but you can't appreciate it. So you'll see if it is large or not. So in the diagram, maybe they can't tag it because this one will come out as black. Just not something that will look bigger veins, and especially this one, number 21, is the internal common carotid, but which one is specifically the right internal common carotid artery. 20, it's right internal jugular vein. 19 is right subclavian vein. Number 18 is right subclavian. Sorry, that 19 is right subclavian artery. 18 is right subclavian vein, because it is larger than the artery. Again, this side, this is should be, so 15 should be the superior vena cava. 15 superior vena cava, because it is coming from the on top of the heart there. 15. Number 14 is the bronchus, but which one specific? 14 is the bronchus, right main bronchus, because that is right. Okay. 12 is the descending aorta. 12, descending aorta, or thoracic aorta sometimes. So you need to know that diagram specific. The host features, you need to know them at least. Even this one can come. Like I emphasized on the other one, this one is the mediastinum. So you are just from doing the mediastinum, and they can bring this one so that they confuse you a lot. So how do you know what you are doing? Identify the features that are really visible. Number two, what's that? Number two is the sternum, but which one specific? The manubrium of the sun, because we said the sternum divides the superior mediastinum into two. Okay, we said on top, when it divides, what is the angle of the way it divides it? It divides the superior and the inferior. So the superior and the one that we're talking about there. So everything that is there on top, they are part of the superior. Therefore, two will become the sternum. But which part of the sternum is the manu? Two will become the sternum. But which part of the sternum is the manubrium of the sternum, number two? What about what is 16? 16 is something that is very nearest to the manubrium of the sternum. That is number 16. Number 16 is the thymus. That's a gland. Number one is the brachiocephalic trunk. How do you know that it's the brachiocephalic trunk? Brachiocephalic trunk is the one that branches to give what? Lies to two right common carotid and right subclavian arteries. Okay. From there, you've got number three. Number three is larger. So that one is definitely a vein. So it's a vein there. Number 4 and 16 and 14. These are internal thoracic arteries, number 4 and 16. Four is the phlenic nerve. Oh my God. Okay, so you people check out that. Don't skip it. Know it. Know that one. The mediastinum. They can bring it like that. So at least not 10 things or 50. You know, Dr. Mtarega. This one we've done it, but let me just mention some things. We've been doing this one. We know that these ones are coming from their directory. We know this one. This is the superior vena cava. Number 5. 5 is the superior vena cava. So if it is superior vena cava, meaning that it will branch into what we call the brachiocephalic trunk or brachiocephalic vein. So we've got the right one and the left one. And then we have got the arteries behind there, which are coming directly from there with the left common carotid, left subclavian artery. Very simple and straightforward. Even this side, this one is 11 is the vagus nerve 11. Vagus nerve, but we don't call it the vagus nerve. It's called recurrent laryngeal nerve. Why do they call it recurrent laryngeal nerve? Because it wanders. It comes this side and it goes back. It on the right side, it comes and wraps on the left on the right subclavian vein. But this side it works on the arch of the aorta on the left. So on the left is arch of the aorta. On the right, it works on the subclavian vein and goes back. Even this one, maybe it can come. So just have to go through it. You have to go through it, you people. And that marks the end of all the diagrams that I'm having in my phone. So I've sent you the questions. They're on Telegram. Go through them. And the diagrams, they're enough to make you pass. Don't even stress out. If you want to can even sleep, because sometimes what will happen is that. So this important diagrams to take note of. This one will come. And then this one as well. As long as you did that, this one might come. This one not really, but just for the sake of going through them. There is this one. This one I'm suspecting that they can bring it. This one, because it's a bit troublesome. Even this one, they can bring it. So make sure to go through the diagrams properly. Know at least some features. The ribs and the vertebrae, know them properly. So the questions are answers that I sent on Telegram. Go through them. I'm very tired. I need to rest and start some biology. Okay. So all the best, you people. Don't stress out. Just do the little things that I've mentioned. You'll make it another time. Okay. Good night.